You know, whenever you have any sort of injury or pain problem, you likely want some tests to arrive at a diagnosis. Now, you could have x-rays or MRI scans, maybe even blood tests. But in my view, the most important test you can have is a test of your muscle system. The reason is that muscles run virtually everything, certainly every movement-related problem. And the reason I've tested every muscle in every patient visit for over 30 years is because muscles betray so much vital information that you can't get any other way in a physical examination. So when you're testing muscles, you're testing movements mainly. Muscles control movements, and so when somebody can't move properly or without the strength or speed that they should have, the muscle examination will show it. And that's why it's really important to have every muscle tested every visit, and I can't think of a better way to direct my treatment except via what muscles are not working properly. You see, if a muscle's not working properly, it's either that muscle failure has allowed the injury to happen, or the muscle is weak because the injury has happened. And either way, if I can restore that muscle to normal strength, then I've solved the problem, essentially. And I found over all of those 30 years, when I can get somebody with no muscle inhibition at all, they are as well as they can be. And it turns out from all the research now that there is a strong link between your strength and your longevity, so that you live longer the stronger you are. And also you live better, you get less injuries, you get more vitality, your brain works better, everything works better when you have a strong and robust body. And so that's why it's important to test everything, because you're only as strong as your weakest link. And even a slight muscle weakness anywhere in your body can turn into a problem. And that's why it's important that every muscle is examined. So just as an example, let's say if you had a bit of problem with your hip, maybe you weren't walking as well as you should, or maybe not running as fast as you'd like to. We could look at the hip, and one of the major muscles of the hip is the gluteus maximus, this one here. This is the one that propels you. So we want to know that the glute max is strong. We would lift the leg up behind you, and you would push up against me so that I could feel how much resistance and strength that muscle had, and the speed and stamina by which it was activated. And if there's nothing wrong with that, we move on and we hunt for your weaknesses. But if it was weak, then we would take steps to establish normal strength, because if that was weak, then the hip joint is not protected. And if the hip joint is not protected and it's able to move badly, that can cause into pain and disability and possibly hip arthritis. And so we want to make sure that that doesn't happen. And by going through every muscle, we're testing every joint, muscle, bone, and nerve in your body to make sure it's all working as well as it should do. If you'd like that to happen, you can contact me, Simon King, at Naturality, and I'd be happy to organise an appointment for us to run through all of your muscles and make sure you're as healthy as you can be.